Hello, everybody. Thank you for joining. Thank you for coming in. I appreciate everybody stopping by and having a listen to what I have to say. For anybody that doesn't know me, I am an ICU nurse working um, in a unit in a small hospital, and our unit is the only ICU, and we get all of the ICU COVID patients that come in. Um, So we've been fairly stressed and fairly um, short-staffed, and to the point where we're expanding our ICU into our PCU, which is our progressive care, which is still part of the same area, uh, but we just don't have the staff. Um, it is pretty bad, Mike. Um, we are seeing mainly non-vaxxed. We are seeing several vaxxed breakthrough cases. Typically, your vaxxed breakthrough cases that come in are the ones that are um, unfortunately have severe comorbidities to go along with it. Most of the cases that are coming in that are fairly severe that end up in the ICU are just unvaxxed cases, people that have refused or haven't gotten the vaccination. Hello, Tori. Thank you for joining. Um, so that's kind of where we're at right now. So I did want to share a little bit of data. Um, and this is John Hopkins, and I want to pop off the screen so that I can actually kind of go through some of the stuff. Um, and so what I want to show is this is US. This is our total cases here, 38,000. Our 28-day cases. In the last 28 days, this is how many cases that we've come across, 3.4 million. And there's our total deaths, 28-day deaths. And then this information over here is kind of your weekly cases. It's kind of like, instead of going day by day by day, it's just by each week. So back in 110 of 21 was our highest week ever. We had 1.723 million cases. But if you look at the different waves that go through, and we're considering this to be the fourth wave here at this point. Our first wave was here. This is the second wave. This is still the third, and it had a little bit of spike on the third before it finally came back down to a low amount. And now this fourth wave has spiked up incredibly quick. And then the last recorded week, as of 8/22, there were 1.031 million cases that week. Um, and I just kind of want to compare, if you kind of just look at the numbers, but not so much the numbers, but just the charts of the different countries. I want to kind of compare four countries: US, UK, Australia, New Zealand. Are the ones that I really want to focus on. And another thing, I put it up here on the incidence map, or incidence rate. So if you look at the incidence rate in the US, it's 11,000 per 100,000. But if you go to like the UK, if you look at their spikes, it's not quite, it doesn't follow the same pattern as US. But Delta arrived there a little earlier than it did here. If you start looking at the cases starting to go up, plus their population is considerably smaller than the US. Um, but they've had a total of 6 million cases there. So it's still a lot of cases. And it's still just under a million cases, 800,000 cases in the last 28 days. And then if you go down to Australia, which I've got to scroll down a little ways to get to, if I don't pass it because I passed it last time, there's Australia. If you look at Australia, their incidence rate is far lower than both the US and um, the UK. It's only 188 per 100,000 people. And if you look at their cases, they really have only ever had three waves. They kind of, the third wave that we really saw in this area here in beginning of 2021 or the first part of 2021, they never really had because they were pretty strict on their mask mandates. But if you look at their numbers now, this wave is the worst that they've had in Australia. They're reporting um, 5,000 cases in a week, and that's in a country that population is not as big. And then if you go down to New Zealand, which I know is quite a ways down the list here, and I passed it like 3 times when I was scrolling looking for it earlier. Let's see where that's at. Nope, I've gone too far. There's New Zealand. Now, if you look at New Zealand's numbers, and New Zealand did a very good job in the very beginning of this. They had several cases, but if you look at like their caseload, their highest caseload at one point within a week is 525. Now, granted, this is also in a country of only 5 million people, but Jacinda, their prime minister, took this very seriously from the very beginning. Put things in a lockdown to try and prevent people from getting this as much. And if you look at their numbers, they fluctuate back and forth a little bit, but they've never really seen another spike until now. Just in the last week here, they had 128 cases, which is they have not seen that since April of last year. They haven't seen those types of numbers. But if you look at the bottom list here, this shows their vaccination rates as well. They're vaccinating quite a few people. So people in New Zealand are taking this seriously, and their incidence rate is also fairly low as well. So there are many different factors into why it affects people differently. There is a blood type difference, type O versus type A blood. I always get it mixed up, and I always have to look it up. One is more affected than the other, and that's one thing I can never remember. I always have to go back and look it up. Uh, but it's not just the fact that they can't breathe. COVID attacks the body in many different ways. It causes clotting issues down to the cellular level, causing microclots to clot the smallest of capillaries in the places like the kidneys, places like the capillary beds of the lungs, uh, even in the brain, which when the body starts losing oxygenation because of blood clots to areas of the brain, areas of the heart, the kidneys, those cells start dying off slowly because they're being deprived of oxygen. Um, so those are some of the consequences of COVID itself. You can't necessarily, it's not just about breathing. I mean, that's one of the major ways that it does present itself. It does present itself as a respiratory illness, but it does also, um, yes, brain damage. It will cause brain damage because it will cause, like I said, micro clots in the smallest vasculature of the body, in the capillary beds, causes these little clots. Um, that prevent oxygen from getting to the cells at the cellular level. Um, I'm Breakthrough infections can cause long COVID as well. We have seen that in people, but these are, like I said, typically your people that are having breakthrough infections that are already vaccinated are the people that already have some comorbidities, already have some um, underlying health issues, be it the fact that they were a lifelong smoker and their lungs are already damaged, or they have a history of maybe having pneumonia or all sorts of other things. Um, the worst case of COVID I've seen in patients, I can't count on I can't count on both my hands and both my feet how many people have died in front of me, Mike. How much worse does it get than that? Um, I mean, I don't know what's worse than than that, honestly. But some other things I do want to touch on while I was here, and let me change what I'm presenting here to another tab on my browser. So, yeah, and there are people like that. There are people that they maybe have just enough brain function to keep their body alive, and that's about it. On a ventilator, go to an LTAC, long-term acute care facility, where they will be taken care of probably until they die. Don't know how long that will be for some people, but that's a possibility. I think that for some people, it is a fate worse than death in some cases. But I want to bring this up here too. This is CDC's numbers. I'm going to look into this here. So this is the United States itself. This is our 7-day average, is following the red line. Current hospitalizations are following the orange line. And then the daily cases are actually in the blue hash lines going up. So if you kind of follow and look at the lines, you'll see that your 7-day average follows basically your cases, but your your hospitalizations kind of lag behind everything else. And it looks like we really didn't start collecting this data until sometime in August of last year. Prior to that, they weren't collecting hospital data to be compiled in this manner. But if you look and you follow that hospital line, it always lags behind a little bit. So typically, what you're seeing is your cases here are kind of lower. I mean, it's not that this many people are hospitalized, because if you look at it, the hospital cases are on this large scale over here. The COVID cases are on this large scale over here. The hospitalization cases are on the orange scale on the other side. So that's the number of patients at any given time in hospitals. So if you go to the most current data, which goes back to the 23rd, it shows that we currently have about 86,000 hospitalized people just in the United States alone. New cases that day were 115,000. 7-day average was 141,000. So I mean, those are big numbers. And then to compare those, especially where I live in Florida. I'm in the Tampa area. If you look at Florida, Florida kind of really didn't see much in what we call the first wave. Second and third waves, we really saw a lot more. But this wave, if you look at it, it just shoots straight up and it continues to go up. You see these little dips in here, but there's little dips everywhere. Just depends on how many people are getting tested in a given day, how many tests are resulting in that given day, stuff like that. So just like these couple little dips here don't mean a whole lot until you see the whole graph progress out. And what you're seeing with Florida has a population of 21.9 million. And we have cumulative deaths here in Florida of about 42,000, 42.7 thousand. And if you look, our mask mandate was lifted on May 3rd. So if we scroll around here to May 3rd right, where is it at? May 3rd, right there. If we scroll down here to May 3rd and look at the cases at that point, you'll see that they were still continuing to go down for several weeks. But as more and more places lifted their mask mandates, and now that the kids are going back to school, especially in August, we're starting to see a lot more cases. We're having school districts, the school district closest to me, where I work, last I heard, had about 8,000 people in quarantine, including students, or mainly 8,000 students in quarantine, and several hundred staff members in quarantine at this point already. I think it does correlate with mask mandates. I think that masks, because one thing that I did say, hey, Jason Park, thanks for coming in. With mask mandates, one thing that we did see, and one thing that we did notice, and I've spoken with other nurses about this previously too, that I work with, is typically last year during flu season, we would see several dozen flu cases come in. And it was typically your elderly people, your people that were immunocompromised that would get the flu and get very sick, end up with pneumonia on top of the flu, just because their body couldn't fight it off. Like a normal person can normally fight off most flus. But we saw relatively no flu cases last year. Um, I could probably count on one hand how many flu positive patients I remember seeing in our ICU last year during flu season. And from flu season, I'm talking about like Octoberish to March. Um, so not really last year, but last flu season. I could literally probably count on one hand how many people I saw. And I think that had a lot to do with people wearing masks. And what we're seeing now, COVID is not just a stronger flu, it's a different disease process altogether. It is still a virus, but it acts differently than a flu. It does not respond to the same medications that flus do. And it is in its own genome altogether. It's its own living entity, technically. But let me go back into this real quick. Oop, wrong button. So yeah, that's Florida in a nutshell there. Now, if we go down to California, which is another state which has a lot of cases overall, but if you look at California and you see that they've really only ever had 3 waves, they kind of slowly went up. And this is kind of where the second wave was that we saw in the US. And then the third wave was huge for them. And now the fourth wave, they're not seeing as many cases. Their hospitalizations are still going up. They're still seeing quite a few people hospitalized by this strain, by the Delta strain. And I think the last numbers I saw was over 90% of all cases right now are Delta, based on CDC testing. But if you look at this, they have about 8,000 patients right now on your 7-day average cases. And hospitalized patients only have about 7,800. So that's a far cry for a state that has literally, well, not literally, nearly twice the population of Florida. They have half the hospitalizations of Florida at this point. And one thing that difference between Florida and California, if you look at the data, is that they did not lift their mask mandates until June 15th, whereas Florida lifted them back in May 3rd. So I think that a lot of this has to do with when the mandates were lifted, when people stopped wearing masks, when people stopped caring about wearing a mask. I mean, I'm double vaccinated. I've had both my vaccinations. I'm also immunosuppressed. I do qualify to get the 3rd vaccine, which I have not been able to do just logistically because of my work schedule. But I do plan on getting it as soon as I can. But if you look at how California has done overall, they lifted their mask mandates a lot later than Florida did. And they seem to be faring better at this point. If you go to another state, like Texas, for instance, they lifted their mask mandate back in March. So almost 2 months before Florida, March 10th. Florida was not until May 3rd. And you see their cases going up as well, and their number of hospitalized patients was about 12,000, which is slightly behind Florida currently. But they have more of a similar population of Florida as well, 21 million versus 29 million. So you're kind of comparing apples to apples there a little bit more than you are with California, who also, like I said, kept their mask mandate going a lot longer. How many people die from the flu versus corona? I would have to actually look that up, Tori. I don't know data on that specifically. I do know that I want to say, I'm trying to remember what I had. I had some figures on this months and months ago, but it was maybe 1 million people a year on average, depending on the strains that are out, depending on how many people actually get infected, die worldwide. Um, some years are worse than others, of course. You go back to the Spanish flu of the early 1900s, 1919, 20, they estimate 20 to 50 million people died during a Spanish flu, and that lasted 2 years. Um, I don't know, Shell Lady. That is a good question. I don't know if and when we will defeat this. I don't know that people are just going to um, go out and get the vaccine. I heard that even Trump at one of his last rallies was telling people to go out and get the vaccine, and he was being booed for it, which to me is just hilarious. But um, my opinion on those who won't get vaccinated, there are a number of reasons why people won't get vaccinated. I think that people that have researched it and just don't want it, but they've done their research and they're informed. That's one thing. But people that are just following conspiracy theories and listening to Fox News and watching people on Facebook and YouTube rant about how the vaccine will make you sterile or will make you, it changes your DNA, it changes your actual genetic makeup. Those types of conspiracy theorists, that type of stuff, I don't see any merit in any of that. There is no research that shows any of those things. Um, but not everybody is going to get vaccinated. That is something that is just the way it is. But what we need as a country is about, I believe the last numbers I saw were somewhere between 75 and 80% of the population to be vaccinated in order to develop a not a herd immunity, because I hate that term, because herd immunity and kind of implies that we just let everybody die until everybody that isn't going to die isn't going to die. But kind of like a built-up immunity from having so many people have the vaccine that it's not as easily able to spread. Yeah, we use Regeneron on patients all the time for people that are coming in with mild cases. There are actually clinics set up for people with mild cases in Florida just to get infusions. Um, Jason, the two COVID vaccine from Pfizer is enough for most people to not uh, die. It's not necessarily going to prevent somebody from getting the infection, but what it does is it does lessen the severity of that infection. But for people that do have um, chronic illnesses, for people that do have um, underlying health conditions, it's not going to prevent those people from dying. I've seen people die that have been vaccinated, but those are typically people that do have other health issues other than COVID. They have severe uncontrolled diabetes. They have chronic kidney disease already because of their uncontrolled diabetes. They have um, a history of heart attacks, bypass surgeries, multiple stents, things that just unhealthy people throughout the course of their life go through and they get because they don't necessarily have because they necessarily haven't taken care of themselves in the way that they probably should have. But the last state that I wanted to talk about actually was Utah, because it's a real small state as far as population. They have about 3.3 million people there. But if you look at their data, they kind of have had really two waves, and then they're kind of slowly creeping up on a third wave, not as fast as places like Florida, Texas. And their bed usage and their hospitalizations are not horrible right now. They currently have about 379 hospitalized COVID patients, and that's from data from the 23rd, just a couple days ago. New cases 906. So they're not. I mean, Utah is not doing as bad, but if you look at this trend going up, like I said before, we have to see where this goes before it starts coming down. Is it going to continue to go up like this? Are we going to start seeing it spike up faster? Because that's kind of what you see here is it kind of goes at a curve and then you see the spike. And if you look at a lot of these, you'll see that. You'll see where it kind of starts out not going up as fast, and you see spikes. And then you see these dips and stuff like that through here. But if you kind of level this out and kind of turn it into a bell curve, statistically, you see that, I mean, it kind of works out in the that you're having, sorry, I lost my train of thought there. I'm pulling myself back up. But yeah, that is kind of all that I wanted to cover. And Johns Hopkins, right now, they're one of the dashboards that I follow a lot. I do follow the CDC. There were a couple others that I was following that kind of stopped updating after a while. So I kind of don't follow all of that, all those different sites anymore. But Johns Hopkins has been very reliable data for a long time. CDC is a very reliable source of data as well. I recommend if you want to do your own research, those two places are very good places to do it. Stay away from places like Facebook to do your research. mRNA vaccine weakens the immune system as the vax wears off. I have not seen anything about that, Mike, honestly. And I don't see like scientifically and what I know about how the mRNA vaccine works. I don't know how that is the case. Because if that were the case, they would strongly advise against immunocompromised people to get it. And like I said myself, I am immunocompromised, and I am planning on getting my third vaccine as soon as I can. Well, Jason, I don't think that any governor at this point is mandating vaccines. There's talk about it in a lot of states, mainly blue states. Of course, Abbott's not going to mandate a vaccine. He's probably not going to mandate masks for a while. Even here in Florida, our governor, Ron DeSantis, put out an executive order telling schools that they were not allowed to actually put mask mandates in place for this school year. Stating that if they did, they would lose some of their funding. And that seems to kind of have backfired at this point because multiple school districts have had huge surges in cases to the point where some of our bigger school districts in the country, Miami-Dade, down in Miami area, they have already started enforcing mask mandates. With the only opt-out to be a medical reason. And they just did that here in Hillsborough County as well. It's supposed to be a 90-day mask mandate here in Hillsborough County that says that yeah. And if you look at the data from New Zealand, Let me bring that back up real quick. Um, they are taking it seriously. That's the difference between New Zealand and the United States. You have a prime minister who took it very seriously from the very beginning. Um, Keep in mind too, New Zealand, Jason, only does have about 5 million people in it total, which most of our large cities have more than that here in the United States. Uh, I know just where I live, in the area where I live, Tampa, the Tampa area has about 3 million people. And Tampa's not considered a major metropolitan area. It is one of the bigger cities in Florida, not as big as Miami, but it is a decent sized city. But here's I left it up on New Zealand. So here, this is their total cases in New Zealand, 3,160. They've had a total of 26 deaths in the entire country. Now, if you scale that up and you divide 5 million into 26, that's a really, 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 really small percentage. Versus here, where we're 1 point something percent or 2 point something percent. I haven't even done the numbers in a while. That was something I used to do back when I was on Periscope. Um, but look at the number of vaccinated doses they've administered. 3 million vaccinated vaccine doses administered in a country of only 5 million people. So that to me tells me that they're taking it very seriously. And if you look at their 28-day deaths, they've had 0 deaths in 28 days. And if you go back and look at the death chart here, all of these days are 0. You don't get a death until you come back into February 21st of 21. It was the last time they had a COVID death in New Zealand. And like I said, they've just taken this very seriously from the very beginning, whereas we haven't. We've had horrible leadership. I will pull up Israel. Let's see. I have not actually looked at them in quite a while. I know they're higher up the list. Let's see. Yeah, there's Israel. Israel, if you look at their incidence rate too, has an incidence rate very similar to the United States. 1 million cases, but you know what? I don't even know what the population of Israel is, and I know it's not huge. So I'm actually going to look that up real quick on my tablet. Nine million people as of 2019 in Israel. So you're looking at, out of their 9 million people, they've had 1 million cases. So you're looking at over 10% of their population has contracted COVID at this point, which is an astounding amount. Because if you look at United States, um, we have 38 million, we have 330,000, and it's roughly maybe about the same. So yeah, I mean, yeah, 10%, just off the top of my head without actually doing the math. Yeah, Australia is similar to New Zealand. Their caseload has been fairly low. They even though they're a very conservative country, they have a conservative prime minister. They did a lot better than what we did here in the United States. And if you go and look at places like Brazil, who kind of followed after what Trump was doing, Brazil's case numbers are ridiculous right now, and they have been. And Brazil does not have the resources to um, combat this as well. Places that have done very well, if you go and look at John Hopkins, like New Zealand, Singapore, Korea, um, South Korea specifically, because I don't know that we even have accurate data out of North Korea. Uh, but a lot of your Asian countries have done very well because to them this is just another thing. They've been masking up for years. Bird flu, swine flu, every flu that comes around, they throw masks on, and it's not infringing upon their rights. It's just they don't want to get sick. I know that Singapore specifically, when COVID first came around, they mandated masks in schools like almost immediately, January of 2020. Um, and Singapore's infection rate is ridiculously low. Their number of cases has been low. I think they've had spikes just like everybody else of certain days and however many people are being tested and things like that. But overall, they've done fairly well because they took this seriously from the beginning. They took the steps to say, hey, everybody's got to wear a mask. Everybody's got to do this. Everybody's got to do that. And people said, okay, um, because it's not infringing upon somebody's rights to tell them to wear a mask. Uh, you wear a mask because you don't want to get sick and because you don't want your neighbor to get sick from you or the person that you're walking past down the sidewalk or passing in a shopping center if you're someplace where you're in a live environment with other people. Um, you do it because you don't want to bring it home to your children. You do it because you don't want your children bringing it home to you. You have them masked when they go to school. You do it because you don't want to go visit grandma on the weekend and grandma end up in the hospital 2 weeks later and die 3 weeks later. That's why people mask. So I don't know. I haven't done much research on the Lambda variant yet, Jason. So I've been kind of just focusing on Delta and what's been going on currently. Um, as you know, I haven't been on here in quite a while. This is only, I think this is my third broadcast in the last week's time. Uh, but I had kind of taken a break away from Periscope and away from broadcasting just because um, the stress levels and summer and just everything that was going on in the hospital and at work. I just needed some time to just step away for a little bit. So I'm not as up on everything like I was before. Um, so that's something I will definitely look into, though. Um, yeah, I know Sydney area is. I actually have a friend of mine that lives in Sydney that I speak to on um, Twitter on occasion, and they let me know that they just left me a message saying that they were back on lockdown again. Um, but I haven't been able to really talk to them much. Other than that, that's about all I know from them. Um, and I do know that they are rolling out vaccines a little bit more in Australia too. They were able to secure some more doses of the vaccines so that more people can get vaccinated in Australia. I know that that was an issue for a while. Um, but yeah, that's really about all that I had to go over tonight. Let me look at my notes again real quick. Make sure I didn't miss anything. If I go to the right thing here. No. Oh, and one thing I didn't, I don't think I said this, but the first case of Delta was actually discovered in the U.S. back in 2020, in December of 2020. So since then, it's become the main variant um, that they're seeing now, that the CDC is seeing. Um, no, the tests themselves do not detect which variant you have. The tests themselves are actually um, just negative or positive for COVID. The way that we find out what the variants are, and this is not typically something that is that's even sent back. Like you won't specifically know if you have Delta or if you have Lambda or if you have Alpha or Beta or whatever variant is out there. Um, what happens is the CDC says, okay, you tested 1,000 people a day. Send us randomly 100 of those tests. So the CDC will take those 100 tests and they will test those 100 out of the 1,000 or whatever their magic number is. And they'll say, okay, out of those 100, 90 of them were Delta variant, 5% were Beta, and 5% were Lambda or whatever. So they'll say that, okay, in this area that we took these 100 tests from, they have a 90% Delta caseload. So that's how we find out, that's how we know where Delta is hitting harder. Because it's not, the genomic testing is not something that is readily available and can be done everywhere. It's not a test that any blood lab can just do. It's a specific test that has to be done in highly specific laboratories that does genetic testing, because that's what they're looking for. They're actually doing genetic testing on the strain of COVID that one person might have. And that's why they're not testing every single one of them, because it takes time to do that, and it's expensive to do the genetic testing. So that's how they test and find out which variants are prevalent in areas. I see specific areas of the United States. You typically, I would say your more blue states are probably going to initiate some lockdowns. I don't know about curfews again necessarily. And California honestly is not doing as bad as other states, as bad as Florida, Georgia, Texas, Florida specifically. So I don't know that California is going to go on lockdowns. They might start requiring more strict mask mandates in California, but I can't see them specifically going into a lockdown again, unless things start getting worse there, which is a possibility. Hopefully it doesn't. Hopefully it doesn't get worse there. Hopefully, and I keep hoping this kind of every time I go back into work at this point, that when I go in, we're not going to have 19 out of our 24 beds filled with COVID patients, that we're going to be down to 15 or even 17. But it hasn't happened yet. My ICU has 24 beds in it in total. We don't have the staff for 24 beds, but we are typically running with about anywhere between 19 to 22, 23 COVID patients in the ICU on any one given night when I'm working. So it's stressful. It's a lot of work. Taking care of COVID patients is not the easiest thing in the world, just because of all of the PPE that you have to go through, the putting on gowns, putting on gloves, masks, double masking, all that stuff that's involved in just going into a COVID room. And you can't let your guard down, because Delta is much more contagious than the other variants. You can't let your guard down when you're going into these rooms as a nurse. We've had several nurses that I work with have had COVID. They've had mild to moderate cases. Yeah, the monoclonal antibodies are available to just about anyone that meet the criteria. The criteria is basically having had COVID and being labeled as having a mild to moderate case. If you have a severe case, the monoclonal antibodies aren't as effective, so they're typically not giving those to people with severe cases. Those are the people that end up getting hospitalized, that need to go on medications like remdesivir and Actemra. So they're not getting the Regeneron or the monoclonal antibodies. But then some people, we have had patients that come in, they're just kind of, they're the doctor kind of sees them as a guarded case, like this could go either way. They may put them under observation for a couple days and say, okay, well, let's see how this goes. Let's go ahead and give them the monoclonal antibodies. But then while they're there, they might digress. They might get worse. So while they're already there in the hospital, so we have had patients that are in the hospital who've had the monoclonal antibodies, but it's typically the ones that are more on the higher moderate end, let's just say, where we hope that the monoclonal antibodies would make them better within a couple days and they could go home and recover. But they just kind of take a turn for the worse sometimes. So, but I don't have a whole lot of other things to say. Heard Pfizer and Merck is making an outpatient antiviral medication. I know that they're working on something. I don't know how close to um, rolling out that is yet, Jason, because there's still a lot of testing being done on that stuff. And when you're doing an outpatient medication, it's not like remdesivir or some of these other drugs that we are using under emergency use guidelines by the FDA. These drugs that are being used in an outpatient setting have to be fully accepted by the FDA for use. Because even some of the therapies that we're using now, like remdesivir, are still technically labeled under emergency use in the hospitals because they literally found that this is one of the few things that actually does work. And it doesn't necessarily cure people. What they found is with remdesivir, all it really does is shorten the length of COVID just by kind of knocking down the viral load in the body. It's not a cure, but it is something that can help somebody not get as sick or not end up on a ventilator or end up needing ICU level of care. They might have to stay in the hospital while they're getting their remdesivir, but then start slowly feeling better after that and can go home. So I think that an outpatient antiviral medication is still a ways off at this point. I know that, like I said, I know they're pushing for it. I know that there are a lot of studies, and I know that there are several different medications being tested at the moment. I can't even keep up with all of them, honestly. But yeah. So I think I'm going to wrap it up. So yeah, I just kind of want to, as a summary, real quick. The Delta variant is still, and probably will be for a good portion of the remainder of the year, the most common variant that we have here in the States. I strongly urge people, if you have not been vaccinated yet, to get your vaccines. If you get, no, the treatments are not paid for by the government. The treatments are billed to your insurance, shell lady. So these medications that people are getting, I don't even know the cost of them. We used to have access to a flow sheet in our charting system that would break down the costs of things, but they took that away about 3 years ago, 2 years ago, something like that, where I could go in and I could actually see how much it cost for a patient to receive a Tylenol, which was a ridiculous fucking amount of money. But they took that kind of stuff away from our view. It's still there. We're just not allowed to see it, I'm sure. But I do, like I said, I do urge everybody, if you haven't had the vaccine, if you know somebody that hasn't gotten it, to encourage them to go out and get it. And to continue to wear masks. Washing your hands is still one of the most effective ways to prevent the spread of COVID and the spread of anything, honestly. Flu, colds, any type of stuff like that. We're coming up on some of the areas of the country I know are starting to get a little bit cooler. We're coming up on a cold and flu season. Just washing your hands helps prevent that kind of stuff as well too. And I think speaking back to what I was talking about earlier about not having much of a flu season last year, I think that the emphasis that people had on wearing masks and washing their hands probably helped with that a great deal as well. Um, so, um, yeah, wear your masks, um, practice social distancing where appropriate, try not to gather in large crowds. Um, I know that people are starting to go back to places like sporting events and stuff like that. You wouldn't catch me in one of those places at all. Uh, I'm not a sports fan for one thing, but I just can't see myself actually going into an event where I know that probably half or more of the people in that place are not vaccinated. It's just not some place that I personally want to be. Um, back when, and I'll tell you this little story here real quick. Back when COVID was kind of on the downsurge, back at the end of the third wave, Comic Con was actually coming here to the Tampa area. And my daughter's big into that kind of stuff. She does cosplay and has a Likey account and stuff, or a TikTok account and stuff like that. And she posts videos on and stuff. And she enjoys doing that type of stuff. So she wanted to go to Comic Con. So we'd actually bought tickets. And we were going to go. And I told her, she's vaccinated, I'm vaccinated. So we're still going to wear masks, but we'll go to Comic Con. Um, and then when the surge hit again and it started going up, it was like right when Comic Con was supposed to happen. So we were not able to go. I told her, I said, I can't take you there and risk getting sick or us getting sick or you or myself getting sick. And she was heartbroken by it, but she understood. She's 13. She's old enough to reason with and understand the seriousness of all this. So I'll leave you all with that. So I mean, COVID has ruined a lot of people's plans over the last year and a half. It's ruined a lot of lives too. A lot of people are without their loved ones, their family members, their mothers, fathers, grandparents, things like that. Um, but I urge everybody, like I said, stay safe, keep your mask on, and wear it correctly. Keep it over your nose. That's one thing that bugs me. I see that out in public all the time. People have their mask right here, and that doesn't do you looking good. You might as well just throw it in the trash at that point because it does you no good doing that. So all you've done is just waste a mask that somebody that actually could have used it the correct way. Would have served that mask much better or served somebody else much better. No idea, Jason. If you look at the data and you look at the numbers, we're still on an upswing. I don't think that we're going to see the end of this anytime real soon, unfortunately. I know that some of the preliminary data that I've been hearing and I see from some of my sources at work say we're still 3 weeks to a month away from seeing the peak in our general area. Hoping that it's 3 weeks away and not a month or not 5 weeks or 2 months from now. But there's really no telling. So only the numbers will tell, and only people doing what they're supposed to do and doing what they need to do by wearing masks and getting vaccinated is going to help prevent this and slow it down. But in Florida, we are full of idiots. That's why every national news story you see comes out of Florida starts with a Florida man. So anyway, that's about all I've got for tonight. I appreciate everybody coming in. Anybody that's made it this far, I hadn't planned on going for a full hour, but here we are, 55 minutes in. I appreciate everybody coming in. I appreciate all of the comments in the chat. If I missed anything y'all said, I didn't mean to miss anything, but I was trying to keep up with the chat as best as I could. Thank you for coming in. Thank you for any replay viewers. And I am going to head out of here. I hope you all have a good night.